And we now talk to Health Undersecretary and Treatment Czar Leopoldo Vega. Good morning, Yusek Vega. Thanks for taking our call.
Thank you, Ria. Thank you also for inviting me over to be interviewed by CNN.
Sir, could you share with us what exactly are the sentiments of the medical community when it comes to the use of face shields?
Okay, let me put it in perspective in terms of the recommendation of the Department of Health. And the recommendation of the Department of Health is that the face shields will actually add another layer of protection against the transmission of COVID-19. And this layer of protection can effectively be, this can effectively reach up to about 80% in terms of, to 89% in terms of the protection rate. Now, the use of these face shields in their implementation has been focused mainly on the use of this in transportation, in marketplaces, in commercial spaces, indoor spaces, and in fact in working places. Now, in outdoors, wherein there is problems with visibility, and you are not within a crowd, then and you are working, then it is better off to take off the face shield because it will, for practical purposes, it will actually hinder and safety would be an issue. So that's I think, the main recommendation of the Department of Health. It's still the face shield should be used in terms of the places that I mentioned, the market, the transport, the working places, especially those people who are interacting more with customers.
All right, so when will this actually be implemented, being able to remove the face shield if you are in an open space? Because some LGUs are saying they're just waiting for a written order.
Actually, if you take a look at the implementation guidelines of some of the LGUs wherein face shields should be used, they only specifically mention the use of face shields in terms of the workplaces, especially those who are in direct in contact with a lot of customers in indoor, in commercial spaces, and of course in market and the transportation that I mentioned. And these are actually what the most of the LGUs have been trying to implement on these spaces. However, there are also exceptions that they have mentioned, especially if you are working outdoors, and this would definitely affect your vision. And second, those who are actually doing or driving a motorcycle wherein the use of face shields is not a necessity. So there are certain exceptions in the implementation guidelines of the several LGUs in terms of the mandatory use of face shields.
All right, Yusek, I want to go to the hospital utilization rate in the region. Some medical experts, they're asking or calling for stricter quarantine measures in Bicol. But you have Sorsogon Governor Chis Escudero saying that hospitals are not actually that full. What do we know about this?
We just talked with, of course, the different doctors in Naga and with Congressman Salceda of Legazpi, and there are really areas there wherein there's a spike in terms of the number of active cases. Although the ICU rates has not been critical, wherein there is 100% in some of the areas, but they gave us an assurance that the government retained hospital in the Bicol Regional Hospital and the Bicol Training and Teaching Training Hospital in Legazpi will be able to allocate more critical care beds. I think the problem really there, and we talked to Congressman Salceda, is really on the isolation, detection, and quarantining of these patients, of these suspect cases at once. Because definitely this will actually be very critical in terms of the transmission of the virus. So they are now moving towards aggressive PDITR, and we are also giving them support in terms of the needs that they would be having, some like testing and some of the equipment for the intensive care units.
What about here in Metro Manila, Yusek? Can you talk to us about the status of hospital utilization?
In Metro Manila, as we've seen a downtrend or slowly decreasing plateau of the number of new cases, the number of or the HCUR or the healthcare utilization rate it has been going down. It's been low risk, and if you try to disaggregate the intensive care unit, the critical unit utilization rate, it has also gone down to about 50%. So roughly it's a low risk position in terms of the NCR, both for the intensive care units and the isolation and ward beds that we have.
Well, certainly we do hope that is something that continues. Thank you very much, Health Undersecretary and Treatment Czar Leopoldo Vega.